That's an example of one way that you get oppression from the system. A second way, and I want to be very clear that when we talk about providing health care, it's more than just MD doctors that we're talking about, because there are others out there who are facing the same problem: chiropractors, naturopaths, acupuncturists, so forth. That community is very, very important to moving forward in our overall healthcare system. I gave you a little bit of an illustration on acupuncture, but each of these others are involved with patients in much the same way that any regular MD would be, and they run into the same kinds of problems that MDs do with the bureaucratic oppression. So I have a client, I found him, a chiropractor who was referred to me, Dr. Ted Korn, and you can look his stuff up. He's a very interesting character, and in particular very strongly outspoken about vaccinations, and with enormous data. His idea, when he started in practice in the mid-70s, was that the information that chiropractors were giving to patients was very caricaturish. It was like a cartoon. They'd have a caveman lifting a rock and say, "We can fix your back if you get injured," things like that. And he decided to put science-based information into the patient's hands. And so he developed a series of pamphlets, basically about 75 pamphlets that you can see in many chiropractors' offices, that tell you details about how chiropractic works and what it works for, and what the data is, and that sort of thing. FTC took 3 of these pamphlets and took 2 sentences out of one pamphlet and 1 sentence out of each of the other 2 on childhood vaccination, which he said could be dangerous, and you should talk with your physician and ask the following questions, and so on. They took these 4 sentences and said that he was misleading the public, and actually planned to fine him about $5,000 a day for all the days that he had done this, and brought an action against him. It was a funny experience, because I was talking about completely something else when I had just met him, and he said, "Oh, by the way, I have this FTC thing. Can you take a look at it?" And I looked at it, and he had lost the case. He had actually lost. He'd been working this for 5 years. I said, "Wait a minute." And the FTC wrote back and said, "You've agreed to settle this case for this amount of money in this situation and so forth, but we don't like the settlement that we agreed to. We're changing it. So we're going to make an even more tough settlement." So I said, "Well, they've reopened the case. And we had 15 days to respond." And so we responded, and we fought that case. And we were very fortunate to have some intelligent people in the FTC upper leadership who dropped the case once we went in and showed them all of the details of what it was about. But still, his personal lawyer, he said, "What's the best advice you have for me to deal with this situation?" And he said, "Liquidate. Get rid of everything you've got, turn it into cash, and hide it." Now that's bizarre. I mean, how can you live in a world where that kind of thing's going on? But we were very fortunate to get in there and change that. And he's gone on and is a very, very active, outspoken chiropractor. And I just want to mention again, there are more than MDs at stake in this situation. The patients and clients of these other professionals are also being treated just as badly as the MD patients that we've been talking about. The third case is one I have which doesn't even involve a professional, not a professional healthcare person. It's a case I'm in right now, and it's a situation where a very small Christian ministry also sells dietary supplements. It's Daniel chapter 1. You can look it up on the internet. What the FTC did is what they call an internet surf. And they caught about 130 people, groups, something, making statements that connected curing cancer with food or dietary supplements, primarily dietary supplements. And they made the argument that that's completely fraudulent, it's not legitimate, you can't do it. And about 25 or so of those companies just immediately went out of business, and all but our group signed a consent order with the FTC, and they're all very, very upset because they don't think they did anything wrong, but they're just hounded into doing this because it's hundreds of thousands of dollars to fight these battles. And so this little ministry said, "We're going to fight." And this is where that cancer doctor came in and said, "Well, if you're going to put an herb on the market and make a claim for it, then you'll have to test each one of the components as a new drug, and then after you're done with that, if you pass all the FDA stuff, then you can say these things. But the key to our case is that they never said this. They never said it cured cancer. What they did is go to places like the European protocols for herbs that list what herbs are for, what they're recognized for in Germany. And they used all that kind of data. The debate we're having in this case is, does data like that meet the FTC requirements about misleading, or are you required to do a double-blind study on animals and then on humans and so forth at minimum of $100 million for each ingredient? We brought in James Duke, you may know about, who's the world's most knowledgeable person on herbs, and he went over each one of the claims that we made, that the client made in each one of the products, and said these are all supported by data about herbs. We brought in a naturopath who works with herbs, did all kinds of research. Yep, these claims are all supported by the data. They moved to disqualify those people because they were not oncologists. They were not trained in cancer therapy, and therefore they could not talk about cancer. We moved to disqualify their guy, saying he was talking about herbs and he's not trained in herbs, so he should be disqualified. So we're having that fight now. We'll see what the judge says about that. Wrapping those three together, by the way, there are dozens and dozens of others. But one of the things, there's one final thing about the ministry. They have hundreds of testimonials from people who follow them. They have a radio program 2 hours a week, 2 hours a day, all week long. They have people that call them and they're involved. They have a whole process. They've been, it's very interesting. One of the things that they did in their career is take Bibles behind the Iron Curtain. They went to Poland, East Germany, China, and this guy says, the head of the thing says, the government in China tried to take our Bibles away, and how we have the government in the U.S. trying to take our herbs away. It's kind of but in any case, what I just want to say is that there are lots of relationships that are going on about health in the society that are outside of this official framework, that are very valuable, that are endangered by and actually are undermined by the kind of processes that I've just been describing to you here. So that's a little bit of a view from where the law is on all of this to support or add to what we were hearing earlier.